In this video by Deckplate we will understand the VA disability ratings for respiratory conditions other than tuberculosis and sleep apnea, bronchitis, chronic bronchiectasis, asthma, bronchial, emphysema, pulmonary. Chronic obstructive pulmonary disease. Disclaimer: this video is for educational purpose only. It's not intended for doctor-patient or lawyer-client relationship. Respiratory conditions can severely impact a veteran's quality of life. The VA evaluates respiratory conditions using specific diagnostic codes based on pulmonary function tests, symptoms, and frequency of exacerbations. Chronic bronchitis. Diagnostic code 6600. Ratings for chronic bronchitis are determined by forced expiratory volume FEV1, the ratio of FEV1 to forced vital capacity FVC, and the diffusion capacity of the lung for carbon monoxide by the single breath method DLCOSB. 100% rating. FEV1 less than 40% of predicted value, or FEV1 or FVC less than 40%, or DLCOSB less than 40% predicted, or maximum exercise capacity less than 15 milliliters per kilogram per minute oxygen consumption. Or right heart failure, right ventricular hypertrophy, pulmonary hypertension, acute respiratory failure, or requires outpatient oxygen therapy. 60% rating. FEV1 of 40 to 55% predicted, or FEV1 or FVC of 40 to 55%, or DLCOSB of 40 to 55% predicted, or maximum oxygen consumption of 15 to 20 milliliters per kilogram per minute. 30% rating. FEV1 of 56 to 70% predicted, or FEV1 or FVC of 56 to 70%, or DLCOSB of 56 to 65% predicted. 10% rating. FEV1 of 71 to 80% predicted, or FEV1 or FVC of 71 to 80%, or DLCOSB of 66 to 80% predicted. Bronchiectasis. Diagnostic code 6601. Ratings for bronchiectasis are based on incapacitating episodes and the frequency of infections. 100% rating. Incapacitating episodes of infection lasting at least 6 weeks total per year. 60% rating. Incapacitating episodes lasting 4 to 6 weeks per year, or near constant cough with purulent sputum, weight loss and frank hemoptysis, and requiring antibiotic usage almost continuously. 30% rating. Incapacitating episodes lasting 2 to 4 weeks per year, or daily productive cough with sputum requiring prolonged antibiotic usage more than twice a year. 10% rating. Intermittent productive cough requiring antibiotics at least twice a year. Bronchial asthma. Diagnostic code 6602. Asthma ratings are determined by FEV1 or FVC ratios, and the frequency of symptoms or medical treatment. 100% rating. FEV1 less than 40% predicted, or FEV1 or FVC less than 40%. Or more than one attack per week with episodes of respiratory failure, or requires daily use of high-dose corticosteroids or immunosuppressants. 60% rating. FEV1 of 40 to 55% predicted, or FEV1 or FVC of 40 to 55%, or requires monthly visits to a physician for exacerbations, or requires at least 3 courses of systemic corticosteroids per year. 30% rating. FEV1 of 56 to 70% predicted, or FEV1 or FVC of 56 to 70%, or daily inhalational or oral bronchodilator therapy, or inhalational anti-inflammatory medication. 10% rating. FEV1 of 71 to 80% predicted, or FEV1 or FVC of 71 to 80%, or intermittent inhalational or oral bronchodilator therapy. Pulmonary emphysema. Diagnostic code 6603. Emphysema is rated based on FEV1 or FVC ratios, and DLCOSB results. 100% rating. FEV1 less than 40% of predicted, or FEV1 or FVC less than 40%, or DLCOSB less than 40% predicted, or maximum exercise capacity less than 15 milliliters per kilogram per minute, or cor pulmonale. Right ventricular hypertrophy, pulmonary hypertension, acute respiratory failure, or requires outpatient oxygen therapy. 60% rating. FEV1 of 40 to 55% predicted, or FEV1 or FVC of 40 to 55%, or DLCOSB of 40 to 55% predicted, or maximum oxygen consumption of 15 to 20 milliliters per kilogram per minute. 30% rating. FEV1 of 56 to 70% predicted, or FEV1 or FVC of 56 to 70%, or DLCOSB of 56 to 65% predicted. 10% rating. FEV1 of 71 to 80% predicted, or FEV1 or FVC of 71 to 80%, or DLCOSB of 66 to 80% predicted. Chronic obstructive pulmonary disease (COPD), diagnostic code 6604. COPD ratings are similar to those for emphysema, based on FEV1 or FVC ratios, DLCOSB, and exercise capacity. 100% rating. FEV1 less than 40% predicted, or FEV1 or FVC less than 40%, or DLCOSB less than 40%, or maximum exercise capacity less than 15 milliliters per kilogram per minute, or cor pulmonale, right ventricular hypertrophy. Pulmonary hypertension, acute respiratory failure, or requires outpatient oxygen therapy. 60% rating. FEV1 of 40 to 55% predicted, or FEV1 or FVC of 40 to 55%, or DLCOSB of 40 to 55% predicted, or maximum oxygen consumption of 15 to 20 milliliters per kilogram per minute. 30% rating. FEV1 of 56 to 70% predicted, or FEV1 or FVC of 56 to 70%, or DLCOSB of 56 to 65% predicted. 10% rating. FEV1 of 71 to 80% predicted, or FEV1 or FVC of 71 to 80%, or DLCOSB of 66 to 80% predicted. Thank you for watching this video. Please don't forget to subscribe and like our video.